What does blood pressure mean and what does it depend on? How does it change with age? How to measure correctly? Watch the video to the end to understand the indicators of blood pressure. Before you start watching the video, we wanted to invite everyone to subscribe to the channel after a mutual greeting. We work for you and wish you good health, so we invite you to watch our videos. Blood pressure is such an indicator of the work of the body, which is necessarily checked by doctors of any specialty during examination. Along with body temperature, the calculation of pulse and respiratory rate indicates the state of the human body. How does blood pressure change with age? With an increase in the number of years lived, the state of the vessels changes, the active lumen decreases, the elasticity of the wall changes, atherosclerotic changes appear on the inner shell. Another influence on the amount of pressure is the hormonal status, which changes throughout life. In children before adolescence, blood pressure figures are slightly lower than the indicated average values for adults. In babies up to 1 year old, 90 to 50 is considered normal. Gradually, it approaches the indicators of parents. In adolescents, it may even be slightly higher, which is explained by hormonal restructuring. In adults, as a rule, approximately the same figures are maintained throughout the life. After 55-60 years, an increase of 10 mm Hg is possible. Boys and girls have about the same numbers. In adult men, they may be slightly higher than in women, which is explained by the difference in muscle mass. In persons of both sexes and at any age, an increase in blood pressure may be associated with the following changes in the condition: nervous stress, vascular spasm on the background of adrenal release, kidney disease, brain damage, exchange disorders, increased thyroid function, obesity, low blood pressure up to a state of shock. A sharp drop below 60 to 40 may be against the background of severe intoxication, especially viral or bacterial, with a high concentration of allergens in the blood, after physical exposure, electric shock, when bleeding, during a heart attack. What does blood pressure mean and what does it depend on? Arterial pressure is the pressure experienced by the walls of blood vessels in different phases of the heart. Blood pressure is determined by two indicators, which are called upper and lower values. Upper or systolic, this is the level of tension of the walls of blood vessels from the blood flow during the contraction of the heart. A lower or diastolic, this is a residual effect on the vessel wall during diastole, relaxation of the heart muscle. The difference between the upper and lower values is called pulse pressure. Blood pressure readings are not constant. They vary depending on the condition of a person, his age, level of physical development, and psycho-emotional state. The amount of blood pressure is influenced by several factors at once: condition of the myocardium, heart muscle, elasticity and turgor of vascular walls, changes in the inner shell of the vessel, the presence of seals and overlays on it, age, constitutional features of the body. Thin and short people tend to hypertension, lowering blood pressure. The amount of physical work performed daily, daily habits and lifestyle, lability of the nervous system, region of residence, living conditions. Thus, the normal blood pressure for a person in accordance with the above data may be completely different figures. However, the average statistical values are considered to be the standard for the indicator of the body's functionality at 120 to 80 mm Hg. But this does not mean at all that absolutely everyone will feel good with such indications. In some, the body is adapted to 110 to 70, in others to 130 to 90 mm Hg. With an increase in blood pressure above 140 to 100 mm Hg, they talk about arterial hypertension, and with a decrease below 100 to 60, about hypotension. Deviation from the usual values leads to a deterioration of well-being, the appearance of clinical symptoms, a decrease in performance. How to measure blood pressure correctly? Tonometers are used to measure blood pressure readings. Modern electronic devices allow you to do without outside help. To properly assess the functional state of the heart and blood vessels, the following rules for measuring pressure must be observed. The measurement should be carried out in a calm environment. Tea and coffee should not be drunk before the measurement, and at least 30 minutes should pass after eating and smoking a cigarette. It is forbidden to move and talk during the pressure monitoring. It is necessary to sit in a comfortable position. The measurement should be carried out 3 times in a row and on both hands. It is necessary to monitor blood pressure in the absence of clinical symptoms in people over 40 years of age once a month, more often according to indications.